Good day. So for today's return demonstration, I am going to assist clients on insulin therapy. So insulin therapy is the administration of synthetically produced insulin extract from the pancreas of slaughtered pigs and cows. It is given to persons who do not have adequate endogenous insulin and administered through subcutaneous route to lower blood glucose. Next is to provide privacy for the client. This is to promote comfort. Next, we need to check the medication and the injection site in the rotation chart. This is to ensure correct administration of medication and keeping in mind the 5 R's in the drug therapy. After that, we need to do the proper hand washing prior to the preparation. This is to prevent nosocomial infection. After that, we need to gather the equipment such as the insulin syringe, the cotton balls or cotton pad, the alcohol, and the prescribed insulin. Also, let us not forget the gloves. We need to rotate the insulin bottle between our hands. This is to bring the solution into suspension for insulin rather than regular. Like this. Slowly. Assuming that this is a insulin bottle, we need to take off the cap and then clean the upper surface with cotton like that. After cleaning the vial or the insulin bottle, get your insulin syringe and then pull back until 10 units like this, and then insert the syringe to the vial and push the air. After pushing, rotate the vial and then get the amount or the prescribed amount of insulin. So before giving the insulin to the client, we need to check first or to double check first the medication card, the insulin bottle, and the dose with another registered nurse. This is to ensure the accuracy of the insulin administer because this is the key to the client's recovery, thus minimizing the side effect of diabetes and insulin itself. So assuming that this is my client, so before we inject the insulin, we need to clean first the injection site using the cotton balls or the cotton pads in a circular motion. So our site here is in the back portion of the arm, like this. So we need to give the insulin in a subcutaneous route at a 45-degree angle. So we need to pinch the injection site and then insert the insulin syringe in a 45-degree angle. So after administering the insulin to the client, we need to observe and teach the client of to what specific signs and symptoms to watch while on insulin therapy. So in using 2 insulin solutions, we need to do the same process like washing your hands and everything. After that, we need to get the insulin solutions, take off the cap, and then clean the upper surface of the vial with a cotton. So the same goes with the 1 solution of insulin. We need to pull back as to what is prescribed unit of insulin. For example, we will have 15. So push back and then get the first vial, which is the NPH, and then this insert and then push the air. So after pushing, remove the insulin syringe and then get the regular insulin and then pull back again to as to how many units it is prescribed.
Let's kick.
For example, 15. Okay, now 15. Then take off the cap and then insert, push, and then without taking it off, rotate the vial and then get the amount needed. After that, we need to get again the NPH, which is the calorie, and then get the amount needed unit or the prescribed unit. So before we administer the insulin to the patient, we need to clean first the injection site, which is in the stomach, in the umbilical region. Again, in a circular motion. So after cleaning, we now inject the insulin to the injection site, which is the stomach. So um, before injecting, we need to pinch a little, and then in a 45-degree, we need to insert the insulin syringe as to the prescribed amount of insulin. We need to emphasize to the patient that he or she is receiving two insulin solutions with different peak and duration effect in the body. So for the aftercare, it is a common practice to place an open insulin bottle ion in the refrigerator and then dispose the insulin syringe and needle after use. Chart the medication and injection site in the nurse's note. Lastly, for the evaluation, the desired effect would be a relief of pain, lowered blood sugar, or the decreased urine glucose. So that's all for my presentation. I mean, for my return demonstration for today's